Hello and welcome to another Behind the Knife video for medical students who want to dominate their surgical clerkships. My name is Elizabeth Maginot. I'm a general surgery resident at the University of Nebraska and Behind the Knife Surgical Education Fellow. Today we're going to do a quick and dirty walkthrough of the abdomen, just the most basic landmarks so you can finally answer that question in the OR, what the heck am I looking at? All right, let's take a look at what we see when the laparoscope first goes in. Your attending passes you the scope and you quickly orient yourself. You're standing on the patient's left and the scope is angled upward and to the right, so you must be somewhere in the right upper quadrant. Now the question is, what landmark should you recognize? So we see the right lobe of the liver with the gallbladder tucked neatly underneath. Just below that is the transverse colon, usually covered by a sheet of yellow fat. That's the greater omentum. The falciform ligament divides the right and left abdomen and suspends the liver in place. As the surgeon begins to move things around, we actually get a better view of some of this anatomy. By pulling down on the greater omentum, we get to see the inferior portion of the liver and the gallbladder a little better. We can also peer up and over the liver and get a good view of that diaphragm. Let's talk about some of the anatomy here. We get a good view of the right diaphragm here and can even appreciate the ridges of the abdominal wall created by the ribs. Next, let's move underneath the falciform and take a look at the left upper quadrant. If we look up and over the left lobe of the liver, we can appreciate the left diaphragm and even see the pulsations of the heart. In the left upper quadrant, we have to move the omentum around to see some of our important landmarks. We can see the stomach tucked underneath the left lobe of the liver. And if we look even further to the left and pull the omentum medially, we're able to see the spleen peeking out underneath the omentum as well. Next, let's drop our view inferiorly and start tucking that greater omentum up and out of the way, underneath the liver. As we do this, we begin to appreciate our intestines. Right off the bat, we can see our transverse colon, which the surgeon is holding up right here. Just below this, we can see some small bowel, likely the jejunum, as well as the small bowel mesentery. Do note that the mesentery is very important. It carries all the vessels and lymphatics that supply the bowel, and it looks a little bit different than the greater omentum that we saw before, a bit of a paler fat color. We get a better view of this anatomy here. All right, next up, we're going to rotate all the way around and move our scope down into the pelvis. We're going to appreciate the sigmoid colon here, diving deep into the pelvis. It's important to note that there's a lot of really relevant anatomy down here, but it's just hard to see without further dissection or putting the patient in a different position. Okay, next let's move to our final quadrant, the right lower quadrant, and we're going to see why we're here. Looks like this person needs an appendectomy. Down here we can see the cecum. You can tell that it's colon because of the tinea cola that you see running up the middle. And then we also see what looks like is likely terminal ileum. Granted, more dissection will be needed. So now that we've gone over all the key landmarks, why don't we get started on this case, and we'll see you guys next time. Thank you for joining, and don't forget to dominate the day.